Hello everyone, welcome back to my channel. So today we'll be learning about congenital anomalies of musculoskeletal system. So introduction. Congenital anomalies of the musculoskeletal system refers to structural abnormalities or malformation in the bones, joints, muscles and related tissues that are present at birth. These anomalies can affect various parts of the musculoskeletal system and may lead to functional impairments or cosmetic concerns. They can range from minor variation to more severe deformities and can impact a person's quality of life. Understanding these anomalies is crucial for early diagnosis and appropriate medical intervention when necessary. So, what are the congenital anomalies of musculoskeletal system that we are going to study? The first one is clubfoot. The second one is development of the dysplasia of the hip. Third is polydactyly, and fourth syndactyly, and fifth is muscular dystrophy. First one is clubfoot. So, what are the types of clubfoot? Varus, valgus, equinus, and calcaneus are the types of clubfoot. First one is clubfoot. It is a congenital deformity affecting the feet, characterized by abnormal positioning of the bones and joints. It represents in various forms, including varus, that is inward turning, valgus, that is outward turning, equinus, that is pointing downward, and calcaneus, that is pointing upward. So in this picture you can see varus, that is inward, valgus, that is outward, equinus means pointing inward, calcaneus outward, calcaneum bone. So remember like that, calcaneum bone, equinus means inward, outward, in front and back. So what are the causes of the clubfoot? Genetic predisposition. Clubfoot often runs in families, suggesting a genetic component in its development. What are the environmental factors? Maternal smoking during pregnancy, advanced maternal age, low levels of amniotic fluid. What are the muscle and tendon imbalance? Abnormalities in the development of muscles and tendons in the fetal foot contribute to the deformity. Unknown factors such as despite ongoing research, some aspects of the clubfoot etiology remain unclear. Risk factors: early amniocentesis, genetic factors, family history, multiple gestation pregnancy, uterine abnormality, fetal neuromuscular disorders are the risk factors. Types: Talipus varus, Talipus valgus, Talipus equinus, Talipus calcaneus. Talipus varus. Talipus varus is characterized by an inward turning of the foot. This deviation from the normal foot alignment can impact both the bones and soft tissues, leading to the challenges in weight distribution and gait. It is crucial to address the condition early to prevent long-term complications such as joint and muscle issues. So this is the picture of Talipus varus inward. Next is Talipus valgus. It involves an outward turning of the foot. This deformity can affect the arch of the foot and the alignment of the ankle, potentially causing discomfort and difficulties in walking. Early intervention, often through orthopedic measures, is essential for managing Talipus valgus effectively. This is outward turning. Talipus equinus. It is a common foot abnormality in which the foot points downward and inward. The condition is present at birth and involves the foot and lower leg. It occurs twice as often in males than in females. It may affect one or both feet. 50% are bilateral. Then is Talipus calcaneus. So the Talipus calcaneus presents as a situation where the foot points out upward. This condition can lead to challenges in bearing weight on the foot properly and may contribute to issues with balance. Treatment approaches may include stretching exercises, orthotic devices, or surgical correction depending on the severity of the deformity. Next is developmental dysplasia of hip. So developmental dysplasia of the hip (DDH) is a condition where the ball and the socket joint of the hip does not properly form in babies and young children. It's sometimes called congenital dislocation of hip or hip dysplasia. So the hip bone and socket of the hip of the babies will not be formed correctly. So the types are preluxation, subluxation and dislocation. Causes: hereditary factor, fetal position, extrauterine compression, breech presentation, neurological disorder. Clinical manifestation: a pain in the hip, loose or unstable hip joint, limping when walking, unequal leg lengths, gluteal fold asymmetry. Diagnostic test: physical examination, ortholanus maneuver, Barlow's maneuver, Alice sign, ultrasound, X-ray, MRI are the diagnostic tests. So in this you can see Barlow's test, dislocation test, where the person will be moving inward and upward. Ortolani test, person will be moving inward and here outward. This is Pavlik's harness. Treatment: bracing, that is Parvin's harness. So bracing is Pavlik's harness. A closed reduction and casting, an open reduction, surgery and casting. A brace or cast will hold the hip in place and will be both sides even if only one hip is affected. Bracing, as I told, Pavlik's harness. It's a treatment for babies younger than 6 months old, usually is a brace. The brace used most often is Pavlik harness. It has a shoulder harness that attaches to the foot stirrups. It puts the baby's legs into position that guides the ball of the hip joint into the socket. The treatment with the Pavlik's harness often lasts about 6 to 12 weeks. While wearing the harness, the baby has a checkup every 1 to 3 weeks with hip ultrasounds and exams. During the visit, the medical team can adjust the harness if needed. The harness brace usually works well to keep the hips in position. Cut through the skin. Moves muscle out of the way to see the hip joint directly. Puts the ball back into place. Close the surgical cut with stitches placed under the skin. These won't need to be removed. Puts on a hip speaker cast to hold the hip in place. The child wears the cast for 6 to 12 weeks. Next is polydactylity. Polydactyly is a condition when the hand or foot has additional fingers or toes, most often the little finger and toe. These two conditions are the most common hand and foot conditions that pediatric plastic surgeon treat. While some children can be treated non-surgically, most children will need surgery. Types of polydactyly is preaxial, that is radial, central, and postaxial, that is ulnar. So here extra one is radial. Here it is central. And here it is ulnar. So what causes polydactyly? A polydactyly can be genetic, passed down in families, or can happen on its own. The extra finger is usually smaller than the other fingers and abnormally developed. It could be made of skin and soft tissue or could include a bone and joint. Next is syndactyly. Syndactyly is a hand deformity when 2 or more fingers or toes are fused together, creating a webbed loop. These are 2 kinds of syndactyly. The fingers are only fused by the tissues of fleshy part, or the fingers are fused between the bones. When fingers are completely fused together, it is called as complete syndactyly. So what causes syndactyly? A syndactyly is caused when parts of the hands, either bone or tissue, fail to separate when a child is in the womb. Syndactyly is often an inherited family trait, meaning parents pass it down to the children through the genes. So in this you can see a symbol, here complex and here complicated. So in symbol, the fingers joined by skin and soft tissue only. In complex, underlying bones and joints together. And in complicated, extra bones and abnormal tendons and ligaments are formed. The last one is muscular dystrophy. So a muscular dystrophy in general are genetic degenerative diseases primarily affecting voluntary muscles. The disorders affect different muscles and have different ages of onset, severity and inheritance patterns. So congenital muscular dystrophy are generally characterized by a diminished muscle tone, hypotonia, which is sometimes referred to as floppy baby. Progressive muscle weakness and degenerative atrophy, abnormally fixed joints that occur when thickening and shortening of tissue, such as muscle fibers, cause deformity and restrict the movement of affected area, contractures, spinal rigidity, and delays in reaching motor milestones such as sitting or standing unassisted. The symptoms of CMD are low muscle tone or floppiness, hypotonia, tightness, contractures of the ankles, hip joints, and knees and elbows, respiratory and breathing problems because of weakness of breathing muscles, eye problems, learning difficulties. Cause of congenital muscular dystrophy. It is a genetic condition. The loss of glycoproteins in cells due to mutation affects the normal function of muscles. This type of mutation causes an increased chance of the muscles becoming injured from a normal use. It also reduces the muscle's ability to repair any damage. So what to know about types of muscular dystrophy? Duchenne muscular dystrophy. This is the most common type, begins between ages 2 and 3. Affects lower limbs first, embeds heart and respiratory muscles later on. The second one is Becker. Appears between ages 5 and 15, has lower progression than DMD. Affects hips and pelvic area first, causes muscle weakness in the heart for the most. Limb girdle. Here starts in either adulthood or childhood. Creates muscle weakness and atrophy in hips and shoulders. LGMD's progression is dependent on the age of onset. So this is a Gowers sign, using hands to push on legs to stand. This is Gowers sign. Diagnosis of congenital muscular dystrophy. There are tests that can help to diagnose CMD. Blood test. A blood test will measure the level of the muscle protein called creatine kinase. In about 40% of the congenital muscular dystrophy cases, the level of CK is 5 to 20 times higher than normal. EMG, that is electromyography test, is used to test the electrical activity muscles. Muscle MRI can be used to show the pattern of the muscles involved, which will help diagnose the type of CMD. Muscle biopsy, which helps to identify which specific type of congenital muscular dystrophy. Treatment. There's no cure access for this treatment is aimed at the specific symptoms present in each individual. So till now there is no cure. The specific treatment plan will need to be highly individualized. That's all about my topic. Thank you so much. So I hope you have understood about this topic. If you have any doubt, you can comment below, and if you suggest more topics, I will be doing it. Thank you for listening. That's all. Thank you for listening. If you like the video, please like, share and subscribe. If you have any doubt, you can comment below, and if you have any suggestions on related topics, you can comment below as possible, and I will be doing as much as possible. Thank you so much. And that's all. Thank you all for listening. If you like this video, please like, share and subscribe, and